Hip and buttock pain can be caused by a number of different conditions and disorders. This video will list and describe some of the most common, but the list is not exhaustive and there are causes that can only be diagnosed with the help of a medical professional. Now, for purposes of this video, we're going to consider the words hip and buttock pain to mean pain that is felt in the general vicinity of the buttocks or the rear area of the hips. Generally speaking, pain in the hip and buttock area is most often caused by nerve, blood vessel, or muscle problems. Sciatica, or sciatic pain, tops the list. The sciatic nerve is huge and it extends from the spine through the buttocks and down into the legs and feet. The sciatic nerve can become damaged in a number of ways. Sitting in the same position for a long time, as many truck drivers have to do, can compress the sciatic nerve. Bad posture can stretch it or pinch it, or it can be damaged by trauma, like a fall or an accident. Whatever the cause, sciatica can cause a stinging pain in the hip and buttock area that just won't go away quickly. Another frequent cause of hip and buttock pain is a pinched nerve. This is a common term for injury or damage to a nerve anywhere in the body, including the hip and buttock area. There's also something to consider called referred pain. Now, pain of this type usually originates somewhere in the spine, but it travels along a nerve pathway and can be felt in the hips, buttocks, or other places. Periformis syndrome occurs when there's a disorder involving the periformis muscle, which is located deep inside the buttocks. Periformis syndrome can cause hip and buttock pain that ranges from mild to debilitating. Claudication. This happens when certain blood vessels in the buttock region don't get a sufficient supply of blood. It's usually because of an arterial obstruction. Claudication can cause you to feel pain during walking or exercising, but generally it disappears when you rest. Claudication may also be a symptom of peripheral arterial disease, or PAD. This is a condition that results from a blockage or narrowing of arteries in the legs. Decreased blood flow to the muscles of the buttocks will cause pain in the hip area. Arthritis. This is one that causes pain for a lot of people. Arthritis causes inflammation in the joints. Since there are several huge joints in the hip area, arthritis can present as hip and buttock pain. Bursitis. Bursitis pain comes from an inflammation of the fluid-filled sac between a tendon and a bone. Several forms of bursitis can affect the buttocks and hips. Osteoporosis. When bones in the pelvic region become weak and brittle, as occurs in osteoporosis, pain will appear in the hip and buttock area. Sacroiliitis. Sacroiliitis is a condition that occurs due to inflammation of one or both of the sacroiliac joints. These joints are located in the lower spine and pelvis. Sacroiliitis can be caused by a number of other disorders and conditions, including injury, pregnancy, arthritis, or an infection. There are some serious conditions in the organs of the lower abdomen that can cause hip and buttock pain too. Various forms of cancer are the most serious. Colon cancer and rectal cancer usually present no symptoms in the beginning, but as they advance to later stages, they can cause pain in the hip and buttock area. Cancer can also occur in the bones of the pelvis. Finally, pregnancy can strain joints and muscles of the buttocks because a woman has to carry the additional weight of an unborn child. This pain usually goes away, of course, after delivery. Now, if you're experiencing hip and buttock pain, your best source of information, of course, is your doctor, and you should only act on his or her advice.